Our next speaker is Dr. Gasch, and in addition to being an ophthalmologist, she is a registered dietitian. And so we have a couple of talks coming up with Wendy. So her area of expertise is uveitis. She works at Washington Hospital Center. She's director of uveitis in the ophthalmology department at Washington Hospital Center and Georgetown. She also does a lot of community-based work for the poor and the underserved, and so we thank her for blessing those people. So she'll talk first about how your diet might potentiate wet AMD, and then she'll next speak with us about onchocerciasis and its control.
Alrighty, well, Dr. Lai's talk is a tough one to follow. Very informative and well presented. I'm going to do 2 consecutive talks, and I'm going to cut the first one a little bit shorter than scheduled because I'd like to devote a little bit more time to the second talk, which is about one of my absolute favorite subjects. I don't have any financial disclosures for either of the talks. Okay, so in this talk, I'm going to contend that your diet might potentiate wet age-related macular degeneration, AMD for short. So to do so, I'll summarize some recent intriguing and also award-winning research indicating that there might be a link between the gut microbiome, which diet can govern, and the development of wet AMD. Well, first some background information about the gut microbiome and the macula. The normal human and mouse gut microbiomes consist of large numbers of bacteria, viruses, fungi, and single-cell organisms termed archaea. More than 90% of human and mouse gut bacteria are from the phyla Firmicutes and Bacteroidetes. Those phyla are key players in the material that I'm going to present. For those in the audience who are not eye care providers, I should mention just a little bit about the macula and AMD. As most of you know, the macula is the oval area near the center of the retina that's responsible for central high-resolution vision. And this slide shows the effect of AMD as it progresses. There's loss of central vision, but peripheral vision is maintained, and there's never total loss of vision. In developing countries, AMD is the primary cause of irreversible legal blindness among individuals 65 years or older. And worldwide, it affects 30 to 50 million people, including 3.28 million individuals in the US. That's 1.75% of the US population. And as most of you know, there are 2 types of AMD, dry and wet. In dry AMD, which afflicts about 80% of patients with AMD, the macula thins and small clumps of fat combined with protein develop under the retina, the so-called drusen. In wet AMD, abnormal blood vessels grow beneath the retina, and that's termed choroidal neovascularization, abbreviated CNV. The vessels may leak blood and other fluids, and that causes scarring and faster loss of vision than dry AMD. Dry AMD can become wet AMD, but not vice versa. There's no cure for dry or wet AMD, but treatment may delay progression of the disease and possibly blunt the severity of vision loss. So the exact cause of AMD is not known, but inflammation clearly plays a role in its development. Multiple risk factors are known. Some risk factors cannot be controlled and some can be controlled. Uncontrollable risk factors include family history. Genes play a role in 3 of 4 cases. Caucasian race, possibly due to genetics and/or skin pigmentation. Light-colored irides, maybe because they provide less protection from light than dark irides. Female gender, age over 50 years. 1/3 of US adults over 75 years have AMD. And controllable risk factors include prolonged exposure to light, specifically UVB exposure. Factors reducing blood flow and thus oxygen delivery to the retina, which consumes oxygen at a high rate. These factors include smoking, which increases the risk 2 to 5-fold. high blood pressure and inactivity. Obesity is also another risk factor. Body mass index greater than 30 increases risk 2.5 times more than a lower body mass index. And another controllable factor is dietary intake, low in green leafy vegetables and other foods high in antioxidants, and or intake high in fat and high glycemic index foods. High glycemic index foods are foods that rapidly raise blood sugar, such as starches like rice, potatoes, bread, pasta, and cereals, and sweet foods and drinks, including juices. Green leafy vegetables contain high amounts of the potent antioxidants lutein and zeaxanthin. Lutein is dispersed throughout the retina, and zeaxanthin is highly concentrated in the macula. And it's that last risk factor, namely diet, where gut microbes might play a significant role in promoting wet AMD. And I'm going to now explain that. Researchers fed one group of mice a regular mouse diet with 15% fat and another group a high-fat diet with 60% fat. They then treated all mice with laser to induce blood vessel growth beneath the retina having the effect of inducing CNV. Thus, the researchers mimicked wet AMD. Mice fed a high-fat diet showed a 60% increase in CNV compared with mice fed a regular diet. In addition, gut bacteria of mice fed a regular diet were 66% Bacteroides and 33% Firmicutes. But those proportions of bacteria reversed to 19 and 67% respectively in mice fed a high-fat diet. Also, mice fed a high-fat diet plus an antibiotic that prevented overgrowth of firmicutes had 65% Bacteroides, similar to the mice fed a regular diet, and less than 10% firmicutes. And their frequency of developing CNV after laser treatment was similar to that of the mice fed a regular diet. The antibiotic was neomycin, which cannot penetrate the gut. So, gut bacteria appear to play a role in CNV development in mice. But how? The high-fat diet, but not the regular diet, was linked to increased permeability of the intestines and to low-grade inflammation. Apparently, in mice fed a high-fat diet, substances triggering inflammation leak through the intestinal wall and stimulate the immune system, thereby causing inflammation that promotes CNV. And in case you're wondering, the increased gut permeability was indicated by a high plasma fluorescein isothianate dextran concentration and a reduced expression of tight junction proteins. And the low-grade inflammation was indicated by elevated production of IL-6, IL-beta, TNF-alpha, and VEGF-A. Furthermore, fluorescence-activated cell sorting of retinas and sclerochoroid RPE was done and showed a twofold increase in microglia and mononuclear phagocytes in high-fat fed mice compared to control regular diet fed mice. And neomycin treatment abolished these effects. Both cell types are major players in the immune system. Interestingly, mice fed a high glucose diet or a high fructose diet had similar proportions of gut bacteroides and firmicutes to mice fed a high-fat diet. Like the high-fat diet, the high glucose or high fructose diet increased gut permeability and boosted systemic inflammation, which theoretically could promote CNV, though in this case, CNV was not studied. So significant sources of glucose and fructose in the human diet are starches and sweet or sweetened foods or drinks if the sweetener is sugar or high fructose corn syrup. High fructose corn syrup is an inexpensive sweetener often used by the food industry. Of course, mice might differ from humans in the regards that I've just described. However, in a human study of 11 individuals without AMD and 12 individuals with wet AMD, the group without AMD had significantly higher amounts of gut bacteroides than the group of individuals with AMD. That study was much too small to make any generalizations, but it, plus the mouse studies that I've just described, suggest that modification of the human gut microbiome by diet might modulate the development and/or progression of wet AMD. So, your diet might potentiate wet AMD. So I'll finish with that bite of food for thought, and any questions or comments?
Thank you so much.
Well, thanks for your attention.